All right, welcome everyone. Thanks for joining us today. My name is Jillian McConnell. I'm the Knowledge Translation Specialist with brainXchange. And on behalf of my colleagues from the Canadian Coalition for Senior Mental Health, also known as CCSMH, we welcome you and we're so pleased that you're able to take part in this event entitled Forum on Financial Fraud, a conversation about the mental health impacts on older adult victims. So a few housekeeping items to address before we get underway. The audio is provided via your computer speakers, so please ensure that the speaker icon at the top of your screen is green and the volume is high. I want to bring to your attention, actually, I'm going to switch screens here for a second. There we go. I want to bring to your attention two boxes on the screen on your right side. If you have a question, actually the one on the top right of your screen is the Q&A box. And if you have a question about any technical issue, please use that section to seek answers or clarity. Additionally, later on in the panel and the group discussion, if you have any questions you wish to address with our panel members, you can ask them in this Q&A box. In either case, questions to the presenters or for support, simply type into the type here box at the bottom of that Q&A box and hit enter. And only the presenters and I can see your questions, not your fellow participants. In addition to the Q&A box, there's also a chat box located immediately below on the right side again. And this is really for more of a discussion box, and we want to encourage lots of exchange during this event. So this chat box is where you can share your thoughts and ideas and feedback, possible resources that you have, and also upvote others' thoughts as well. So please keep in mind that this space is open to everyone and your name will be shown next to your comment. Additionally, a copy of the slides from today's presentation will be made available through the links posted at the end of the event, and these links can be also located within the event listing on the brainXchange website. As per usual, this presentation is being recorded, so within 2 to 3 days, it will be up on the brainXchange website within the archived events section. Excuse me, and all participants will receive an email in their inbox notifying you when the recording is ready. We encourage you to pass that link on to any colleagues who weren't able to join today. And as noted earlier, if you are having technical issues, we just ask that you respond back to the confirmation or reminder email, or you can send an email to webinars@brainexchange.ca. You can see that email address hyperlinked in blue in the Q&A box, and we'll be able to assist you via email. So for all intents and purposes, those are the major features and housekeeping items you need to be familiar with. I'll now welcome Claire Checklin, who is the Director of CCSMH, to review the agenda and make introductions. Claire?
Hi, everyone. Hope you can hear me, Jillian. Okay, perfect.
Yep,
so far, so good. As Jillian said, I'm the Executive Director at the Canadian Coalition for Seniors Mental Health, and I'm very excited to be having this session today. My colleague Monique Beneteau is joining me as well. I think you can hopefully see her there. I can see her. She's in Peterborough, Ontario, and she's helped us organize this session today. So as we've sort of said, this is meant to be a forum and a bit of a conversation. It's not one of the sessions where we're going to teach you a whole lot of different facts and evidence-based things. We want it to be a little bit of an open conversation about a topic that I think is a lot of us are encountering and that's troubling for a lot of us, and that a lot of us might have experience on and knowledge or questions or concerns. And we're hoping that it's the first of several conversations on this topic. For me, the reason that we're doing this, or one of the initial reasons, was a personal one with my mother. My brother texting me one day something to the effect of, did you hear from mom and what she's done now, kind of thing. And I, after some back and forth texts with my brother, found out that my mother had, like many of us, sort of given some information to some scammer online or something. But the part that stuck with me was that when I spoke to my mother later on the phone about it, she sort of said to me that from now on, she wasn't going to answer the phone at all. She was going to have her partner answer the phone. And, I just remember reflecting on that and thinking how sad that is, that she was going to adjust her life and reduce her life and sort of narrow her life because of something somebody else did. And also that she was embarrassed. And I felt badly about that. So that year, I spent some time just trying to find some tweets about the mental health side of financial fraud in older adults and how to help older adults sort of get past that part. And I could find almost nothing. So that started me, as sometimes happens with me, on a bit of a voyage, and brought us to eventually having this session today. So what we're hoping to do is have two presenters speak to you a little bit about their perspectives on the topic of mental health and financial abuse or financial fraud. And then we have a few questions that we've set up for them, but we do welcome you to put questions as well in the chat as they come up to you, and we'll try to integrate them as well. So we have a few questions for the panel at that point. And then we really hope that it's an open, a little bit of an open arena after that, with discussion from all of you about things that you know, things that you've seen, things that you'd like to see that maybe CCSMH can help with, and so on. So with that, I'll introduce you to our speakers who are joining us. We have, we've got Dr. Joshua Wyman, who's going to be speaking to you first. Josh is an assistant professor at King's University College at Western University. His research focuses on improving best practice methods in interviewing older adults in criminal investigations. He's also completing research that explores older adult fraud victimization, prevention, and intervention, as well as the prevention and reporting of older adult maltreatment in healthcare settings. Dr. Wyman is also a licensed school and clinical psychologist in Ontario. After that, we're going to hear from Robert Maschio, who's with FINRA, which is an investor education foundation in the United States. He's been there for 19 years, and he's the director of investor education outreach. Rob cultivates and manages FINRA Foundation programs and partnerships related to investor protection and the prevention of financial fraud and exploitation. He also helps drive research surrounding financial fraud, the victim experience, and scam susceptibility, as well as facilitates investor issues committee. And then after that, not as a presentation, but as part of our panel, we've got Dr. Kim Ritchie joining us. Kim is assistant professor in the Trent Fleming School of Nursing, and she's a registered nurse with over 25 years of clinical and leadership experience. Her research centers around the mental health and trauma, with a particular focus on enhancing care for older adults who have experienced past trauma, especially those living with dementia. She also investigates PTSD and moral injury among individuals in high-risk occupations. Very excited to move on to hearing from Josh first. Actually, I'm sorry. I meant to ask you a few questions first to set us up here. So you guys can answer that on there, what your opinion is of the approximately 50,000 reported fraud instances in Canada each year. How many involved older adults? And this is just to get a gauge, and also to see what we're thinking in our own heads. So we give a second for that. I already see a high proportion is thinking it's the highest number there. It's the first time in a while I've done this, and there's many distractions on the screen when you're the moderator. It's not good when I'm having a distracted day. Can we flip to the results? I think it's Karen. I'm not sure if she can, but the answer to the question was 17,000. So it's on the lower side. And I suspect that's partly because of the reporting part of it, not necessarily of how many are actually happening, but rather are reported. And that's something that I hope the panel will touch on a little bit about some of the reasons for that in their presentations, but also that we will talk about as a group. And the next question. So according to CARP, that's the Canadian Association of Retired Persons, How many older adults reported being targeted by for fraud? What proportion? And that's a very vague question, of course. I mean, even just this week, I've had Purelator text me 3 times that there are packages waiting for me, but it's not necessarily a direct fraud, I suppose. The answer to that one is 86%. And for me, something I found interesting there is just the difference between older adults when just asked about fraud, the number percentage that talk about that they have been targeted versus, of course, the reporting side of things. And there's a multitude of issues that both Josh and Rob and all of us can discuss around that. And then we have one last question for you here, which is just on average, just about for your guys' own experience in your work you do. How often do you encounter, well, look at that, it's going up and down and all over the place there. So again, this is about somebody who's actually able to talk to you about it, willing to talk to you about it, keeping in mind that 86% have been frauded or say that they're frauded. So that's interesting. It's sort of a little bit all over the place there. Some of you are hearing about this often, which is great and hopefully means that you're approachable, but also that some older adults are telling you about what's happening, but also terrible for you probably in your professions because it's such a difficult thing to manage. Okay, with that, now we're ready to hear from Josh, Dr. Wyman.
Hi, everyone. Can you hear me okay? Okay, amazing. Well, thank you so much for being here today. It's an amazing pleasure to be able to speak to you and be part of this wonderful panel. So I'm going to be talking to you today just a little bit about the impacts of fraud in terms of its impacts on older adults, particularly in Canada, and as well as discussing things like the emotional impacts, some of the barriers to reporting, as well as with regards to how you can have a conversation with someone about this, because it can be a very sensitive and difficult conversation. So last year, the Canadian Anti-Fraud Centre received over 108,000 reports of fraud in Canada with a total loss of $638 million. I want to be clear that this is actually an underestimate because it is estimated that less than 10% of cases of fraud actually get reported. And investment scams, those are ones where someone calls and asks you to invest in whether it be a company or some initiative, sometimes it's a charity initiative, and you give money and then they disappear. Those had the highest dollar loss of $311 million, but identity fraud was the most common. In terms of scams that target older adults specifically, there's been a big rise in what's called emergency scams. The common one that you may have heard of is a grandparent scam. And that's where a person will call them, claim to be their grandchild, and say that they really need money and that it's an emergency, such as I need money for bail, I need money for hospital bills, I've been arrested. And then in a state of panic, the victim sends money, whether it be via wire transfer or they'll send a proxy to pick it up the next day, and then they lose their money. It's really heartbreaking because they're targeting on the emotions and how much the victim cares about their family. And we've actually seen a big rise in terms of older adults being targeted in 2022. Older adults lost $9.2 million to this scam, which is much higher than in 2021, which was $2.4 million. I also have some US statistics here. So obviously a larger population, so there's a significantly higher number of cases of scams and frauds. But last year in 2024, there's $12.5 billion lost to fraud, with the average loss being just under $500. I wanted you to see kind of the second row here. As you can see, adults ages 20 to 29 are the most targeted and have the highest percentage of being a victim of fraud when compared to those 70 to 79. However, when you look here, older adults lose on average far more money per scam. So those ages 70 to 79 lose on average $1,000 for each scam, whereas those those between the ages of 20 and 29 lose just over $400. So you can see there's a lower prevalence of being scammed, but there's higher financial loss. And then I also want you to be aware of a great survey that was done by Equifax in 2024. And they surveyed 1,500 Canadians, and they found that 96% of older adults indicated that they wanted improved fraud protection through their banks, financial institutions, and through the government. And 91% wanted better access to education about fraud and how to prevent it. So you can see most older adults want improved education and improved prevention. We're doing an ongoing study where we're interviewing victims or near victims of fraud. And to date, we've interviewed 15 older adults. And among these older adults, they discussed 25 different cases of fraud. And 11 out of the 15 identified being victimized or being approached multiple times in terms of by scammers. And we are still collecting data for this study, but I wanted to provide you with some information regarding the emotional impacts of being a victim of fraud. So among the people we interviewed, these were the common kind of themes that came up when discussing their experiences as victims of fraud. So, at the bottom of the graph there, you can see 64% indicated feeling highly frustrated and resentful towards the perpetrator. 60% reported fear, such as fear of being targeted again, fear of future losses, fear for their future. 56% identified increased pessimism, just negativity about themselves and their lives. 48% indicate that they blame themselves, that it was their fault, and that it shouldn't have happened to them. So you can see a lot of self-blame. And then 48% indicated a loss of trust, particularly a loss of trust in other people, such as having, and this goes with pessimism, and more negative viewpoint of others and society. So you can see significant emotional impacts of the victimization. And this was a really impactful quote from one participant that I wanted to share with you. They indicated, "I can understand, like I work in mental health, and you can understand how people get so overwhelmed and so depressed and just say, like, I give up. I just give up." And you can hear so often about people getting taken for all their life savings, and you can see where they just want to die. Well, but really they have taken away so much more, because as an older person, it's what you've worked your whole life for, and you can't get that back ever. But it's also the inheritance that you're going to leave for your children and your grandchildren that they're taking away too. The fraudsters taking away yourself. They're taking away your feelings of competency, right? Now you're getting old and you're looking in the mirror and you've got wrinkles and you've got aches, you've got pains, and I need a new hip and I need a new shoulder. But now I thought I'm obviously not capable and competent either. So you can see the broad impacts that their experience with fraud had on them, both financially in terms of what they planned for, their children and grandchildren, but also in terms of what they think about themselves, their own self-esteem, their own belief in their own competency. It's a tremendous negative impact on them and their lives. So I'm now going to discuss, two really good studies that were published recently. These were interviews with older adults that explored some of the barriers to reporting financial crime, so things that might prevent or discourage them. And they also discussed things that might encourage reporting. Okay, and one of the studies was done in the United Kingdom, and then the other one was conducted in Virginia. And this graph here, or the table you can see on the right, I feel provides a really good representation on some of the barriers to reporting and also the needs of victims. So among barriers, there's technical help, such as they may not believe they could get their money back, or they may lack the resources or not know where to access the resources to get their funds back. So they feel that there's no point in reporting it and kind of having to relive that experience. Another key theme was educational help. They may not believe there's no way of tracking the fraudster. They may not know where to report it to or how to report it to and what to do. So they then choose not to report. And then there's the emotional side there. By reporting it, they feel they may experience intense shame, guilt, embarrassment, distress, or fear. And a common theme was also fear of losing their own autonomy, that they feel that the bank or family may then take control over their finances or their lives, so they may lose autonomy. So that's another barrier to reporting. Among facilitators, or things that encourage reporting, is addressing their technical and fiscal needs, particularly giving them information about where to report crime to, what to do next, contacting your financial institution right away, contacting the Canadian Anti-Fraud Centre if you're in Canada, and being with them along the way, giving them that technical support and where to report it to. Other thing is help about giving education about different scams, increased awareness of the different types of scams and what they do, and how to kind of approach those situations if you are contacted. And then the key thing is rapport, emotional help and support. Just be an empathetic listener. Okay, sometimes just being there, listening to someone, and really, developing a plan together that focuses on their safety and well-being can be a game changer for them. Then finally, I'm just going to talk about addressing barriers to reporting maltreatment. And this is based on 2 guidelines that were developed in the last 2 years, one in Australia and then the other in the United States. And these guidelines help with interviewing older adults, particularly for police officers, but there is also a focus on addressing some of the barriers to reporting abuse and neglect. So the first is speak at the physical level of the person. I'm 6'4", so I know not to stand over someone, sit down, be at a similar physical level. It helps with building trust and comfort. 2, rapport building is key. Don't feel the need to rush into the conversation. Sometimes just have a conversation, get to know them, build that sense of trust. That is consistently shown in the police literature and the clinical literature as being essential to developing trust and encouraging discussions of sensitive topics. 3rd is grant control. Don't just immediately start asking, did someone take money from you? Ask them where they would like to start in the conversation and let them kind of guide it. Next is focus on their safety and well-being. Focus on just kind of ensuring, one, that they can tell their story, but also on helping them feel that sense of safety and kind of hope with the next steps going forward. Acknowledge their fears, worries, and apprehension. It's part of being empathetic listening. Saying things like, oh, this sounds like it's been really tough on you, or it's been really hard. Do not denigrate the offender, okay? I know it might be easy to do that. The reason why I say this is sometimes the offender is their family member. Especially in cases where it's a caregiver, it's often a family member, like their adult child is the one taking advantage of them. And so follow their lead in terms of how they describe them. Some older adults may not want the person to be charged. They just want the abuse or exploitation to stop. And so having that awareness as well. And then reassure them on the next steps going forward. And I'm going to give some resources on the next slide, but provide printouts on the next steps going forward, as well as check in with them after the initial conversation. See how they're doing. See what are some things you can do to help along the way. So some helpful resources for those in Canada. First is the Canadian Anti-Fraud Centre, the fraud reporting information. I have the link here. It's amazing. It gives you all the lists of different resources to contact if you feel you've been approached for a scam or if you've been defrauded. Elder Abuse Prevention Ontario is an exceptional resource. I provide a link to their fact sheets. Here's an example there of a fact sheet that you can print out and give, which describes what a person can do if they've been, financially exploited, as well as resources for places they can contact and what to do next. And they actually provide fact sheets for all different types of abuse and neglect, like physical abuse, sexual abuse, and neglect as well. It's amazing resources. And then here's just a printout that you can do that was produced by the Government of Canada that is intended for older adults, which just gives information about older adult fraud and financial exploitation and what to do. And so giving them a physical copy and walking through it with them can be very beneficial. All right, that's it from me. Thank you so much.
That was fantastic. The quote, I read it before and it gave me tingles again as you read it. And it made me think about my mother and what she was saying about herself after that happened to her. So thank you very much for that. I do see there's a few questions coming in. I think what we'll do is, well, one of the questions is about getting the slide deck, and I think we will be able to share that for sure. We've also put together some resources and are happy to send them on. We're going to ask one other group question, a poll, which has already shot up there. But then we're going to talk to Rob, have him do his presentation. And then after that, we'll have the group be able to bring some of these questions up as well. This is a funny question because I was wondering how honest we all would be about this. So when you hear of an older adult who's been victim of a fraud, how often do you think that the older adult shares some responsibility in that? So we're seeing people flip through here, and I love that 5 people said always, and I would love to chat with them a little bit about that. I think for me, the honest answer is sometimes, and probably much more than I should. It's something I've been trying to open my eyes to in the last little while, if I'm being very honest. With myself, and so that segues well to hearing from Rob, because we found Rob because we found a paper that he and his team had written with the American Association of Retired Persons that reframed the whole concept of financial fraud for me personally, and then I discovered a beautiful package of other wonderful resources that they've been working on. And so with that, I'll pass it on to Rob to tell you a little bit more about his work.
Wonderful. Thanks. Looking forward to chatting with you all. I have some slides here, and some of them actually lined up pretty well with what Dr. Wyman said and some of the information that he's pulled directly from interviews with folks in Canada. But we're going to go through, and thinking back to that poll question, I mean, to be completely honest, the answer should be never, right? We should never be placing blame on the victim, on the individual that was defrauded. But if we're being honest with ourselves, we often do. And it's not because we're bad people or because we really think that they did something wrong and it's their fault. Sometimes it's that protective measure. We like to be able to look at situations as humans and say, well, they did something to end up where they are. They must have done something. I'm smarter than that. I would never have fallen for that. I would never have been victimized by that. They must have done something. So it's almost that protective shield that we put up when we place blame on individuals that are being victimized. But I'm going to talk a little bit about that non-financial costs associated with financial fraud. And again, some of this is going to repeat a little bit about what was said, so I will go over that relatively quick because you don't need to hear the same thing. It's just going to affirm and validate some of the information you've already heard. But first, just to give you a little sense of who I am, who FINRA is. FINRA, we are a private not-for-profit regulator. We regulate brokerage firms. We were put in place by Congress, regulated by the Securities and Exchange Commission, the federal agency responsible for the securities industry. We are not a government agency, though. We are what's considered a self-regulatory organization, and our job that we were put in place to do by Congress is overseen by the SEC. Again, not a government agency. Our mission is investor protection and market integrity. The FINRA Foundation is a subsidiary of FINRA, and we focus on financial capability. And we look to try and help individuals gain a better relationship with money, increase that financial literacy levels for individuals. And then we also focus on what we can do to protect wealth. That's where I spend my time. I focus on the protecting wealth side. So all things related to financial fraud and financial exploitation. All right. And through the foundation, we work with a lot of different partners. We conduct a lot of different research, and we use that research to really drive the programs that we conduct through the foundation. So that's what's leading to kind of this conversation about the emotional impact of financial fraud and how it is more than just the numbers after a fraud has happened. So again, this lines up with the information that you had just heard. This is a study that the FINRA Foundation had done, And we found that nearly 2 in 3 victims experienced at least one serious non-financial cost associated with fraud. So severe stress, anxiety, difficulty sleeping, depression, these are all non-financial costs that individuals that have been victimized expressed. And as you're working with or interacting with individuals who have been victimized, it's really important to keep in mind that it's not your fraud. And what I mean by that is every individual has some level of stress that they can withstand, right? You have your ebbs and flows, and if you're operating in a normal state, you're able to withstand the positive and negative stresses. But when you have a traumatic event, and yes, fraud is a traumatic event, when you experience a traumatic event, you often have higher peaks and valleys. So us as outsiders who is working with an individual who has experienced that traumatic event, we might not understand their concerns, their fears, the trauma, the emotions that they're expressing, which is why we have to remember it's not our fraud, it's their fraud. So I mentioned that just so we can level set and keep a clear mind that you might not fully understand what that person is going through. It doesn't mean you can't be there to support. So I already answered this. Is fraud traumatic? The answer is absolutely yes. Financial fraud is traumatic. And one of the partners that we worked with is a mental health provider, a nonprofit mental health provider. And they work in a lot of different disciplines. And we partnered with them to lean into the mental health impacts of financial fraud. So when we first started working with them, the first thing we did was do a social media scrape. We went through all these different posts online about individuals who came forward and indicated that they were victimized by financial fraud. And we tried to pull out the emotion and the feelings that they were expressing online. And this is what we saw. We've laid it out over a 12-month timeline. So that 0 to 3 months, we've got things like isolation, sadness, embarrassment, guilt. And you can see as we progress down that throughout that year that individual has been after that fraud, you can see 9 to 12 months after that fraud event, some of these emotions and feelings that these individuals are expressing: terror, lack of trust, exhaustion, right? So this shows it's not something that just you get defrauded and you move on. These are feelings and emotions that last a long time, right? This is nearly a year after the event. They're still exhausted. They're still depressed. They're still living in terror. So again, you might not fully understand those emotions and those feelings, but it's important to meet them where they are, that individual, and provide that support that you can. Just as was talked about previously, taking that trauma-informed approach. And I really loved what was said, how to do that with compassion. It's such an important step to take as you're working with a victim who has experienced financial fraud. So I'm not going to go over this because this really just kind of solidifies what was already said, right? Realizing that there was an impact of trauma, recognizing the signs, working that trauma-informed approach into your own internal policies and procedures, and resisting that need to re-traumatize, or that re-traumatization effect. So if we ask somebody to start at the beginning and tell me what happened, then what happened next, what happened next, what happened next, that linear approach, that can cause an individual to relive that trauma. All right, so this gets us to the words that we use. So this is something that I'm really passionate about, and it's something before I started working on this project where we really analyzed the words that we used. I would find myself using things like, oh, well, the individual fell for the scam, right? It seems innocent. It's a word that we often use. Somebody fell for the scam. But by using those words, we're ultimately implying blame and shame on that individual, making it seem like they played a role, that they were somewhat responsible for that fault, for that fraud. They fell for it. When we think about individuals that have been victimized by, say, a violent or a property crime, whether it's robbery, something along those lines, we're much more compassionate. And we haven't always been there. It's taken a little while as a society to be more compassionate towards individuals of those violent and property crimes. But we might meet the individual and say, oh, I'm so sorry that happened. What can I do for you? How can I help you? Can I bring you food? What more can I do to make you feel comfortable? Or talking amongst peers, we might say, oh, they didn't deserve that. That poor family, they're such good people. That's how we talk about violent and property crime victims. When it comes to financial crime victims, we don't take that same approach. We say things like, oh, you got duped by that. You should have seen it coming. That was obviously a scam. You'd have to be an idiot to fall for that. There were so many red flags. You can't account for being stupid. And anybody who's gotten the courage to come forward and tell their story, whether it's verbally telling their story or putting it in print, online article, newspaper article, the comments afterwards are just terrible. And these are some of the better comments that we see in posts. We see people often placing that blame on the victim, right? We don't take that same approach that we do with other types of crimes. So I encourage everybody on here to really pay attention to those words that we use, right? Let's make sure that we're not using words that imply blame or inspire shame. Let's not say things like, well, if it's too good to be true, you should have known better. Or why would you have given a stranger your money, right? Because those words imply blame. They place blame on the victim. They inspire shame. And when we have more shame and more embarrassment, that can cause individuals to not come forward, to not report. So those numbers that we saw earlier about the fraud, the fraud numbers, whether it's based in Canada, whether it's based in the US, whether it's based in the UK, wherever it is, those reported numbers are so small compared to the actual numbers of fraud victims, but they're not coming forward. And part of that is because of the shame, because of that feeling of guilt or embarrassment. And the words that we use help fuel that shame and embarrassment. So let's change our lexicon. Let's change the words that we use. Let's use things like scammers use powerful emotional tactics. They manipulate individuals. Or let's ask, what did the scammer say to deceive you or to build trust? So we're removing that blame and shame, and we're trying to show empathy, compassion, and empowering the victims. So anybody that works in more of an investigative role, you're trying to get specific information to build a case or to understand what happened, this is my investigators edition. And it takes some of those questions that we would often ask. And again, I spent time as an investigator. I spent time leading investigators. And as investigators, we often want that linear approach. We often want to start from the beginning, and it helps us build that case. But if we're really looking for cooperation and we're looking to be compassionate and let the victim tell their story at their own pace, at their own comfort level, sometimes we have to take different approaches. So we might ask them, instead of start at the beginning, we'll say, well, where would you like to start? Or if somebody comes in and reports the fraud or the instance a year after it had happened, instead of saying, well, why didn't you report it immediately? Let's respond with, tell me about your thoughts leading up to reporting. We're still getting that same information, but we're asking the question in a more gentle, a more nicer way, a way that's going to help that individual feel safer, feel more comfortable talking. This changing of our language, it'll lead to more reporting, more cooperating witnesses. We might have law enforcement ready to be able to take these types of cases forward on a more prevalent basis. We might have policymakers that can step in and start understanding, once we get a full picture of fraud, maybe they can start enacting policies to really help victims. So I encourage you all to check your words, check the language that we're using. Now, these are just a few helpful resources. If any of this stuff that I've talked about, and I know it was really quick, if it was interesting to you, we have more of the research that we've conducted on our website, finrafoundation.org. We have a research library that allows you to see some of the research that we've done. whether it's the Words Matters campaign or whether it's information on trauma or chronic fraud victimization. We have all that research in our research library. We also have some helpful tools and brochures and information. We have a Taking Action Guide, which is an advocate's guide for victims of financial fraud. We worked with another organization called the National Center for Victims of Crime, and it kind of provides that step-by-step action that an advocate can take to support a victim of fraud. That is available in PDF. We're also working on refreshing that because we all know that frauds constantly evolve and change. So we want to make sure that that's representative of our current state. But the information in there is still really helpful. There's that little QR code on the PowerPoint here. That'll take you directly to our fraud content available on finrafoundation.org. All right, and with that, here is my contact information. My email is robert.mascio@finra.org. Happy to always hear from folks afterwards. If you have additional follow-up questions or things that aren't covered during today's session, you're more than welcome to reach out.
Thanks so much, Rob, for that. It's always interesting. Sometimes in my work, I think about silos, and sometimes for us, the silos are more the psychiatrists aren't talking to the nurses, aren't talking to the, patients, to the social workers. But there's so many layers of silos, and you and your colleague, when we talked to you a few weeks ago about this session, reminded me that there's even silos like the policing world, the finance world, the investment world, the health world. And older adults, how do we all talk to each other in a way that, we can support each other? And it's been lovely to meet you and see such warm-hearted people in finances and sort of investment work. And so, yeah, that's been lovely. I think, Jillian, at this point, we were going to just sort of take a few sort of clarifying questions and then go to more generalized ones.
That's correct. So just taking a moment to pause here, noting that we still have about 45 minutes together, but just wanted to give some opportunities if people had questions specifically about Dr. Wyman's or Rob's presentation. I see some have come up already, which is fantastic. Some specifically speaking to helping people in a scam online, but they don't believe it's a scam. And I'm referencing those romance pieces that you've both alluded to. This person saying, she knows someone who's in her 90s and she truly believes that it's the real thing. So how to address those sorts of scenarios when they really don't believe that that it's anything to be concerned about. And they're getting joy from it, which is really difficult too, until they're not.
Mm-hmm.
And that's what's so challenging about those romance type of scams, or even companionship, friendship scams. It's not only, there's always an ask for money in some capacity. So whether it is asking for money to visit the person in person, or let me teach you how to trade crypto, I've been really successful, which is the shift that we're starting to see now, where it's more of that companionship. And then from that companionship, that friendship, it's, hey, I've been really successful. Let me teach you how to trade crypto. And it's on a platform that's designed to steal money. That's kind of the new evolution of romance. But you have the loss of money. The loss of money is always going to be there. But then you have the loss of the relationship. And even though it was a fake or fictitious relationship to at least one of the parties, it was a relationship to that individual that was involved in the scam. And that is really hard to overcome. Because you have that person that you felt like you connected with, whether it's a friendship or a romantic relationship. So you always have to be careful when you enter those types of situations. And one of the things that I think is somewhat helpful is being able to give information to that person to digest on their own. So instead of trying to tell them and convince them that it's a fraud, maybe give them an article that talks about other people that have gone through this similar situation, to highlight that it is a fraud. Let them read that on their own and digest. That can be one of those steps that you can take. If it is somebody that's been in a relationship before, maybe they were married and their spouse had passed away, ask them a simple question. Well, is this how you met your spouse previously? Or do you see a lot of the same kind of connections with how you met your previous spouse to this situation? And then see if you can get the light bulb to go off that way.
Great advice. Dr. Wyman, any thoughts on that to build on what Rob was saying?
Yeah, I think, Rob did a wonderful job. I really enjoyed your presentation, Rob, and did a wonderful job covering, the different strategies. And I think a big part is, what we can do is just provide them with information. Obviously, let them tell their story, let them take control, but providing them with just some information about the common types of scams, tactics being used, and then helping them, eventually come to connect the dots, but also having the awareness that this is an emotional attachment. They truly believe that they are in a two-way, long-term, deep relationship with that person. And so I think providing just information regarding the common type of tactics that occur, asking it and using open-ended questions, not telling them, okay, they're doing this, but asking open-ended questions. That's what we do in therapy, is we ask questions to help them develop insight. And so just asking them questions about, even things like, oh, what are things you do together? And a common theme is they've never met in person. And what types of things do they ask you to do? What types of things do they ask you to do for them? And I love what Rob mentioned about just connecting it with their prior relationships for them to be like, actually, this is not a typical relationship. This is not typical to my prior relationships. And so using these open-ended questions to help develop insight, but also be aware that it sometimes can take multiple conversations. Because it does require a lot of understanding and acceptance, and that can take time.
I'll invite Dr. Ritchie if she wants to pop in as well for any comment. And while she's maybe doing so, oh, there she is. Hello, Dr. Ritchie. Any thoughts to contribute as well to this discussion? This first of a couple of discussions we're having today.
Hi, thank you. It's a real pleasure to be here, and our excellent presentations. I really enjoyed them very much. And I, in thinking about some of the comments that you were making, one of the things I was thinking about also was this deep sense of betrayal that you would have when you do experience this type of financial fraud or abuse by somebody who you know and trust. And that seems to be this additional component to it that is linked with mental health, any sort of betrayal. And it kind of gets into that sense of, I can't trust anybody anymore. The world is an unjust place. The world is not fair. And it can lead to this sense of, the world is no longer a safe place, at sort of that extreme end. So, and I think that is also something that's in addition to some of the other pieces that you mentioned.
That's important to note. Thank you for that. I just see there is a question here before we move on to the panel discussion, I guess the formal panel discussion. I think we're kind of already jumping in there. But one of the questions that I saw was to Robert saying, does FINRA conduct research on those who are not yet ready to report?
So we've had conversations with individuals that have not been ready to report. And the reason I kind of skirt around that is if they're not ready to report, it's hard to find them, right? So you might have an individual that has built, so we work with a few different advocates that have built relationships, often in that like kind of chronic fraud instance where an individual is chronically targeted and chronically victimized. So they might not be ready to report their current situation, but they're happy to talk to somebody about what's going on. So we're able to get insights and clarity that way, but we have not been able to run a formal research project focusing on the unreported piece, just because it's so hard to find those individuals that are willing to talk but not report.
That's interesting. It's something I was thinking about is this word report. I think we usually associate that with policing and that sort of thing, or with investment and in investigations. But I think there's that in and of itself is perhaps a goal. I don't know. I'd have to think a lot about it, because I know at least here in Canada, a lot of these crimes, there's just nowhere near the policing and staffing and investigations happening that there should be. The part that I'm particularly interested in is the niche, even perhaps before that, or maybe as well as that. So the part about talking to somebody, not necessarily for to report a crime, that maybe that's a goal, but just having a warm, friendly person to talk to, whether it's the healthcare practitioners across the country, or wherever else. And to me, that's a step. What either Rob or Josh made mention of, sort of, to me, it's a little bit like manning a distress line. If somebody picks up the phone, they've made a step, right? And that needs to be embraced and dealt with in a warm manner. So I think you guys have taught us a lot about that sort of thing. I am interested in hearing from each of you, keeping in mind, your own backgrounds and stuff, that extra layer that I think older adults face sometimes of somehow a fear of loss. So that by admitting to a weakness or a mistake or a misstep, that somehow it could end up in a bit of a spiral of loss. And we've all seen that in ourselves or our own families. It happens time and again. So how to navigate that piece, I'm just interested in, and I don't know if somebody feels like going first, or even if the people online have some suggestions. I think I might start with Josh, just because he's first on my screen. Do you have any thoughts
Before we
about
do that, oh, sorry, Claire, I'm just going to interrupt. Before we do that, I'll switch over to just a different format here, just to give us a little bit. I don't want to scare people. That's why I like to give them a bit of a heads up. I don't like just doing it. Okay, so now we can see each other a little bit better before we sort of open up this panel discussion. So go for it.
Lovely.
Thank you. And Claire, sir, would you mind just briefly clarifying your question again? I lost audio for a little bit.
Oh, heavens, of course you did. It was just sort of around reporting, and before reporting, just talking about it, but keeping in mind the fear that some older adults have of sort of imminent escalating or cascading loss if they admit to an error or mistake in their lives.
Of course. Yes, absolutely. And so this is where, I think a big part is allowing them to take the lead, and about just first clarifying what your role in this. And first is to be a listener and to be here to support you, and just to be an ear. And rather than, coming in, like, just as I see some folks here are counselors, they work in mental health, they work in healthcare, just being someone to listen to and talk to and be there to support them. And I think establishing that role early on really helps to make it a collaborative conversation. Okay. And really allowing them, again, to take the lead. And then another thing is when coming up with ideas for support, I usually like to start by saying, let's brainstorm together, because they know their lives better than I do, or I will ever know. And so brainstorm ideas with them about, their thoughts of things that they can do first, instead of just immediately telling them, okay, do this, 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 and this, and then you're good. Okay. Again, remember, they are taking the lead in this, and they may come up with some great supports, especially when it comes to family and social supports, people they can trust. As Rob mentioned, and this is true in the scientific literature on reporting different types of older adult abuse and neglect, isolation is one of the most commonly cited barriers. Feeling alone, feeling isolated, it's a risk factor for being further victimized, but it's also a major barrier to reporting. And so developing with the person ideas of people they can trust who will support them, and so that they can be in this together. Even just someone, if they need, would like to talk to their financial institution, if they feel better having someone come with them, okay? And just to be there, someone to, even if they say, sometimes what I do with clients as well, if they need to say, they need to call a specific service. Okay, I don't work as a clinician with older adults, but one thing you could do is if they say, I'm not sure what to say or do, by calling the Anti-Fraud Center, say, if you would like, I'm welcome to sit here with you. I won't say anything, but I'm just welcome to sit here with you while you have this conversation, just to be there as a support person so that they're not alone. And then just the last thing is, and as we, mentioned, feelings of guilt and shame is a major barrier to reporting. Providing information about just how common these scams are. Most people probably don't know that in Canada, there's over 100,000 reports last year of fraud. And that is an underestimate because less than 10% get reported. Okay, so just normalizing that, these impact you. And in a conversation I had with a family member about the grandparents, I realized right away this happened because one, the fraudster is in the wrong. They targeted emotions, and what it told me was how much the victim cared about their grandchild, that they would move heaven and earth to help their grandchild as quickly as possible to ensure they were safe and well. And
that's beautiful. That's actually a beautiful thing, isn't it? That's a strength and a beautiful thing that should be embraced in its core. Kim or Rob, do you have any thoughts on that question?
Kim, I'll let you go. I'm happy to jump in, but Kim, why don't you start?
Sure. Okay. Thank you. Yeah, I think, with that sort of cascading loss, I think it really results in a loss of confidence and lack of, you kind of question your own ability to make good decisions around, your financial, but it also could lead to decisions about anything that you just kind of be, the ground or your world's been kind of pulled out from underneath you, and you kind of question the safety of the world and the safety of others. So I think, promoting empowerment where possible, promoting choice where possible, promoting a sense of autonomy in the ability to make good decisions, reinforce that they have made many good decisions. And this is not a result of a bad decision. It's the result of somebody taking advantage of you. So, to take away some of that blaming that Rob referred to earlier. And one of the things I think, even in my own reading before this, is to kind of reframe it as financial abuse instead of financial fraud. And I think when you start thinking of it in that term, then it adds a whole other piece to it, that you see it in a different light, the same as you would other types. And the other thing too is, I know that, and probably Josh and Rob may have more information about this, but I think there are some peer support types of organizations out there. And, again, as Josh was saying, to normalize the experience that others have been in the same boat. You're not all alone. You're not isolated. And that being able to meet others maybe that have had similar experiences will take away some of that shame and blame too.
That's a really good point. Rob, I think I said to you on our call a few weeks ago how moving it was to read an article written by your colleague who had interviewed somebody who was actually in finances and had been frauded out of $50,000, and how brave it was of that person to come forward and to allow her story to be told. It makes the rest of us feel, a little less terrible, or whatever, stupid or whatever else, right? Yeah. Did you want to add anything, Rob?
Yeah. So, I mean, I completely agree. So one of the easiest and best first steps that we can take is, like it's already been said, normalize the conversation. Start the conversation, right? Let's make fraud a common discussion topic, because we know, yes, this has a significant impact on older adults. It has an impact on anybody, right? Whether it's a younger individual that is caring for an older adult, or a younger individual in general, they're getting targeted at high rates as well for fraud. So I like to kind of take that approach of making discussions about fraud a family affair. We know the more that we talk about the scams that are out there and how they operate, the more we know, the better protected we are. We're able to spot it, we're able to avoid it, and it'll make it more of a common conversation. So when somebody is victimized, it's not something like, oh my gosh, I can't believe that happened to them. The other thing is, when it comes to reporting, especially for older individuals, for an older individual, it's very easy to get from, I've lost my life savings to now I'm going to be put in a home because I can't care for myself. And whether it's a true rationalization or not, I mean, it depends on the individual, but a lot of individuals, that's where they go. Well, if I tell my family that I lost this amount of money, I was victimized, I was targeted, and I'm now out however much it is, well, it's going to be very easy for them to say, okay, well, if you can't take care of your finances, you can't drive a car. You can't drive a car, you can't care for yourself. If you can't care for yourself, we've got to put you in a home, right? So again, whether or not that's a real rationalization, I don't know, but it's how that often manifests in individuals' minds. So that's a big burden, right? People don't want to come forward and report because they're afraid that what's going to happen next? Am I going to lose my independence? So I think that's really important to keep in mind. I know Josh mentioned the isolation piece, and I feel like every time Josh has mentioned something, I'm like, oh, wait, we've done research that he just affirmed that our research is probably true. So one of the research projects that we did, we focused on what separates victims from non-victims. It was based off of reporting that was done to the Better Business Bureau's Scam Tracker database, which does span across all of North America. So it does include reports made from individuals located in Canada. And one of those key reasons that individuals engage with fraudsters is isolation. If they don't have a network to talk to, or they feel isolated, or they might put themselves in a state of social isolation where they have a network, but they choose not to talk to them because they're afraid that they're going to convince them otherwise, or something along those lines. But isolation was one of those key factors.
Canada's doing some great work around isolation and loneliness, trying to make progress, trying to make it more of an awareness around it. I know the USA is as well, and of course, UK and other countries. And we have our own project, and I know 2 of my team are on this call, so I'm sure they're taking notes. But absolutely, I agree with you that isolation and loneliness and that sort of thing would be big players. I've got a question that's a little bit about recovery and trauma, and I think I'll start with Kim. But I'll segue by saying that I have no evidence about this. I just have personal suspicions. And I've never asked Google the right questions to find the right evidence about this. But I've always felt for older adults that sometimes there's stories we hear neighbors or our families say where, we talk about a loved one who was doing quite well until something happened. And then it just, the wheels fell off, kind of, and that simplifies the story. But I do wonder about things like trauma, and especially if it's been unrecognized and unaddressed, not talked about, not dealt with the health system or whatever else, if sometimes that can be part of that story. And if so, how, I think we've mentioned a little bit about what we can do to support that and to help it not be the tailspin. But I'm just curious with the trauma lens, Kim, if you have any thoughts, and then anybody else.
Yeah, sure. Yeah, that's an interesting question, Claire. And, I think I'll start just sort of broadly thinking about this and then narrow down, and Josh and Rob, please jump in too. So, if we think about just sort of trauma and financial fraud, I think this is kind of like just a relatively new area, and there's not a lot in the literature, but certainly there's some studies that have linked financial fraud to PTSD, to depression, to sleep disturbances, and so on. And one of the things that we think about when the type of fraud or financial abuse that's caused, and the impacts that it could cause on the individual, is to what extent is their life affected by the event. So it could be the amount of money, and not in dollars, but in the significance to the person and to the impact it's going to have on their life. And some economic losses could be completely devastating. So as Rob mentioned, like the ability to care for oneself independently could, your entire retirement savings could be gone. And then you end up having to be dependent on your family and friends for, simple living arrangements or just your well-being. It could also be the inheritance that you were planning to give to your family could be gone. And that would, impact your ability to be that provider, your identity of what you wanted to do and what you expected to do with that money. So I think that's part of it, is what type of impact did it have on your life? And in some cases, it can be absolutely devastating. Also, another piece of trauma beyond the impact is, what is the meaning and how do you actually think about the event as well? So if you're thinking to yourself, because of this event, I can never trust anybody again. I always make terrible decisions. This is just another type of decision. And you get into that spiral of ruminating and self-blame, then, it's going to have a bigger impact on your life. And that's where we start to think about more the trauma lens. And the impact of loss of self-confidence and other things that we've talked about. And then the last piece, and I think this might be getting to what you were talking about, Claire, is if you've had prior incidences of your life, maybe you're somebody who grew up in a lot of financial hardship, or you witnessed or you're around others who had financial hardship, there could be a potential to actually have another piece to this too, where it could be a reminder. This event is a reminder of the vulnerability or the event that you experience later in life, and could cause you to then experience this event even more so through that lens.
Super. We'll hear quickly if Josh and Rob have thoughts on that. And then I know I would like to hear, I'm seeing things flipping through in various colors on the screen, but I'd like to address some of those, but also ask the people on the call a few quick questions. So Josh and Rob, did you have any thoughts on our last discussion?
Yeah, just briefly. Kim, first, thank you for sharing all that wonderful information. When you brought up the part of sometimes family members notice a notable change in the victim, in terms of sometimes it could be level of functioning, is that especially if someone is experiencing, some of the early signs of cognitive degeneration, like early signs of Alzheimer's disease, experiencing a trauma can exacerbate the symptoms and even sometimes speed up the progression. Because when you think about the impact of trauma, it can cause feelings of severe panic, despair, can negatively impact sleep, which can, all of that increases distractibility, but also it can make the symptoms, early signs of memory loss and level of independence and functioning. It can cause it to progress at a faster rate. And so that's why sometimes family members may notice saying, oh, I've noticed a big decline since this very stressful event occurred. And another thing is trauma can cause changes in the brain. And there's been research with other traumas on that as well, which can have long-term impacts. And Rob showed a phenomenal slide that I'm going to take a screenshot of for sure, regarding the progression of trauma symptoms and the different feelings they experience, after each, 3-month period after the trauma. So I just kind of wanted to touch on kind of that impact in terms of impact on potential level of functioning.
Yeah. And I'll keep my comments relatively short. I just wanted to highlight, so we've done research in individuals as the brain ages, how that impacts your financial decision making. So if anybody is interested in some of that research, again, that's going to be on our finrafoundation.org website. But we did one, and we were able to identify that individuals with declining financial literacy, right? So these are individuals that are cognitively intact. They could be in cognitive decline, but still cognitively competent. It could be a harbinger of kind of more susceptibility to fraud. So if individuals that have been historically very sharp when it comes to finances, and you start to see that decline, that's an instance where you might want to start stepping forward and getting the family involved a little bit more, because their propensity to be victimized by financial fraud can start increasing. But if anybody's interested, I mean, we've done a lot of research with a few different organizations, but we've worked a lot with Rush University and their memory and aging lab to be able to try to understand the impacts of aging and financial fraud. So for anybody that's interested, again, finrafoundation.org has our research.
Yeah, they've got apparently even more stuff than I realized, which is great. But some very key little info sheets and stuff that help facilitate conversations and sort of flip the narrative, which is fantastic. So I'm not sure how to do this. I'm going to ask probably Jillian for help, but I would want to hear from the room as much as possible. I want to reiterate that I'm just so thrilled with the people who have attended and the interest that I'm hearing. I did wonder sometimes if this was just something I was excited about and passionate about, and Monique, or if it went beyond that, and if this could be a helpful session. I do know that there's a lot of overlapping issues that I would love to see us address in subsequent sessions, perhaps around dementia and cognitive impairment and all sorts of things. But I think Jillian probably has some questions to highlight. I also do, and I think in the survey at the end, you'll have an opportunity, but I want to know from the group if there's ideas of things that would enable you guys as mostly as healthcare practitioners or social service providers to better address this topic, if there's sort of resources that you find that are really helpful. And I see there's some coming up here, especially from Elder Abuse Prevention of Ontario, which is fantastic. And of course, there's a Canadian parallel that I'm on the board of the Canadian Network for the Prevention of Elder Abuse that has some great resources on their site as well. But yeah, different strategies, tools that you have. And then, of course, Jillian, if you have gone through all these colored questions and have one or two to highlight.
I do. The one thing I'll just mention before, maybe while we're giving people time, if they have those resources to add into either box, doesn't matter, we'll find them. But just to also just note that some of the ones that people have already provided, which have been excellent resources, and Rayanne, I'm going to call you out from Ontario Elder Abuse, so thank you for that. What we'll do is we'll put those all in the brainXchange resource page under this heading. So it'll be one-stop shop. Everything will be there for everyone to be able to find it. And then I'm sure Claire and Monique and I will cross-reference each other and make sure that we can link our sites together so that if you go to one, you'll get to the other and vice versa on this topic. So feel free to certainly provide any additional resources that you're working with. One of the things that came up that I've noticed is in speaking about those resources, some non-English speaking ones might be, or not might, probably most cases are going to be very helpful as well. So there's people looking for those sorts of resources for non-English speaking population that are experiencing this, but also any potential research. And maybe I'll throw that back to Dr. Ritchie and Dr. Wyman and Rob. If there's any research associated with those that are not where their English is not their first language, and they're having challenges associated with that too, and maybe feeling those vulnerabilities.
I'm not aware of anything myself, but I do know there's a number of multicultural, older adult-oriented organizations in the country, mostly in the bigger cities. I would imagine the US probably has some stuff in Spanish, but and of course we've got French. But Josh, were you going to say something?
Yeah, I can just talk broadly about research that's been done with different marginalized groups, including those where English may not be their first language. Is that it can be a big barrier to reporting because when you think if you don't think that the person that you're speaking to can understand you or help you, they may then not want to share and relive the experience. They may find the whole reporting process to be more hardship than potential benefit. Another thing is there are different marginalized groups that have greater distrust based on history, even contemporary issues with law enforcement, with different community agencies. And so that's another notable barrier to reporting. And that's why, part of recent research has been trying to focus on, culturally sensitive interviewing, having cultural liaisons, having interpreters present to help to kind of remove some of those barriers and really establish that trust.
Rob, do you, just while Jillian skims through the questions, Rob and or anybody, but Rob, because of your financial world, do people answering the phones when you call to cancel your credit card or state these things, do they have any training on how to, to get the nuts and bolts of what happens so that they can protect you financially? But is there any sort of bridging to make sure the person who called, can get the mental health supports they might need, or is there nothing happening there?
So there are definitely, and there's no formalized structure. So it's going to rely on what that financial institution has implemented in terms of training for their employees. So if you're calling, and some have done a better job than others, there's no national requirement that they have this specific training. We've been working, as have other organizations within the financial institution world, to try to make training available and give it to individuals that might be answering the phone. One of the things that I often hear is if you're being targeted by a romance scam or companionship scam, and the person asking for money, if you call up your financial institution, they're likely going to ask, do you know the person that you're giving the money to? Right? That's a normal question that most financial institutions will probably start asking. If I'm in this relationship with the individual, I know them. I might not have met them in person, but I do know them. So my answer is going to be, yes, I do know them. Right? So then from the intake side of that financial institution, they check the box and they say, okay, they know the individual. Let's authorize the wire. But it might be that they're not asking that right question.
I see.
Right? Have you met the person in person? Or ask those follow-up questions. So we are working actively with the individuals that we are responsible for overseeing and that are part of our membership to give that training and provide that training and have those conversations. Different organizations that focus on the banking side are doing that as well. But right now there is no national strategy or national push to mandate that happens.
Okay, super. I see Rianne is mentioning that here in Canada, there's you dial 211 and you can get to sort of community service information, and that they have some training around frauds and making referrals to police and to some acronym that probably has one of the C's, meaning C, Center, Finance, something. I don't know what it is, but
anti-fraud. It's the anti-fraud center.
The anti-fraud group, that's it, exactly. And I see there's, while people are asking for guides, I see there's a guide, somebody asking about a guide, a step-by-step guide for Canada, but if not the US, that we could adapt, but that helps what to do when you've been scammed financially, or maybe helps clinicians know how to advise people on what to do.
That taking action guide that I mentioned provides some of those steps. We also have checklists available for 4 different types of fraud that kind of provide some actionable steps. Those are available on our website. You can get them in PDF, and it'll provide some steps, some actionable steps that you could take.
And I see there's a question here about whether or not they're peer support groups. I'm not aware of one or any in Canada, and obviously always have to caution around peer supports, especially around these sorts of topics, because you have to feel safe among your peers and have them be legitimate peers and not somebody who's going to a group of people who've been victimized by something to find further victims. But I would guess that, again, groups like Rian Rideout at the Elder Abuse Ontario and the CNPA might have some resources. And I would certainly be happy to do a bit more homework, doing some investigation.
I'll just jump in here, Claire. Rayanne has actually provided the CAFC. She says does offer peer support group where senior volunteers actually follow up with victims to provide information and support. So that's fantastic. So thanks. So there is that's in the works, or that's available.
And in the US, we've worked with a few different organizations to set up peer support. It's still, it's still not at a mass scale. So we've worked with one organization, fightcybercrime.org, to run a peer support program for victims of romance scams. And then with Given Hour, they also are running a peer support program focusing again on that mental health component of financial fraud. They have a lot of really helpful resources that we've worked with them to try to build. So if anybody wants to go to their website, givenhour.org/financial fraud, you can see some like little one-pager guides. I know there was a comment about, how to have that conversation with, like, how can a family member have a conversation with somebody that's being targeted and victimized? There's a one-pager on there that'll provide some insight and information there. And I know AARP in the US has a peer support as well. I don't know if CARP does.
Yeah, Kim or Josh or anybody, something we haven't mentioned is even the sort of moral injury of those of us working with older adults who perhaps have lost their life savings and stuff. I think I just want to put a nod to that. Given our little polling question where a good portion of the people on the line said that they know of 6 to 10 frauds, among their clients in the last year, I think it was. How that must feel for the people in healthcare who are encountering that, especially when they don't feel empowered at all to help. Today we've given them some concrete ways to help, but I'm interested to know if you have any thoughts about how to manage the fact that these are ongoing, they keep happening, you're going to keep seeing clients this way, and how difficult that is.
I can, Josh, you can go ahead. Okay.
Oh,
Thanks. Yeah, I think it's a real thing. It can be really hard to hear about these types of senses of these things going on and to feel kind of helpless to stop them. And I think that's the piece that really is difficult to reconcile as a healthcare provider. One is, as you said, it can be morally distressing to see these things happening, and it can almost, be kind of a secondary, if you will, sort of type of impact on you. But I think that sense of helplessness is the pervading piece. So, I think in terms of, knowing what you can do and what you can't do, as a healthcare provider is part of that, and being able to take the steps that you're able to take in terms of all of the great techniques that have already been talked about helping that individual navigate through that, providing support for them to the best of your ability, and then to advocate on sort of the more systems and structured levels with the some of the resources that have been provided here. And then to support each other. I think if there's other colleagues that, you can talk to and to feel that able to share some of these difficult things that you're encountering on a daily basis, that also might be something that could help.
John?
Yes, absolutely. And I know, many of you will have heard of, the term self-care. But in our field, people often put that last because they care so much about their patients, the clients. But it is very important to take care of yourself. And it is okay when you go home to put these experiences to the side, okay? And to live and enjoy your life, because you need to do that, because it's also important for your wellness and your well-being. And so obviously have people, especially, in your workplace, or who can support you. And if you need to talk it out, that is very useful too, but also give yourself the grace of putting these experiences to the side and to enjoy your life, because you deserve that. Okay. And so that's what I've had to come learn, and to accept myself as a clinician, that it's okay for me to put these stories and these difficult experiences that you're learning of from your clients to the side, so that I can recharge and be the best help that I can be for my clients going forward.
Yeah, certainly good advice for all of us, isn't it, every day? And just the mere fact that as many people showed interest in this session as they did shows that as healthcare providers, they're not alone in these concerns that they have. So I think that sort of confirms that we're on a good path having this conversation and supporting each other. Were there any other questions that you wanted us to try to address, Jillian? Or I know we've got some evaluative questions as well.
No, I think there's just been a lot of comments about just thanking everyone for the participation in this great presentation and the resources. But I think we've tackled most of them, and those that we have in a more referencing resources that we can share with each other about what's available out there as well. There is a question about how many people are attending this session. So we have had a few people trail off because I think the hour and a half makes it difficult for some people to attend for the whole event. But we were, I think, at capacity or maximum, I think it was around 210 or so that were in attendance at the beginning. So, oh, Monica is saying 25. So I was close. So a great attendance, and just as a reference point too for people, so that they know, because brainXchange, which I am part of, the organization that I'm part of, is hosting this event. We have over 12,000 members, so over 12,000 people will be getting a copy of this recording, plus the links and the resources that are associated with it in the slides. So, which is great news. So it'll be going out to all of those individuals as well. And I know at CCSMH, Claire and Monique will be sharing it as well on their end. So this will have a very extensive reach beyond what the 205 people that were with us today, which is wonderful, but certainly it'll be helpful for those that weren't able to attend and will be able to access all of this information. I have also seen in the comments, people, I think one person asked for this to be on a monthly reoccurrence. Another one suggested we do it maybe not quite so often, but certainly on a regular basis, because as noted, these sorts of things do change over time, and the scam of the week or the scam of the month sort of thing seems to evolve. And once, I think we become a little bit more attuned to some of those scams that are happening, these people tend to do a bit of a pivot, and they introduce some other way to introduce this sorts of events to our lives. So we'll make note of that. I don't know if we'll be able to accommodate the once a month.
Yeah,
but,
no, not necessarily. But this was meant to be the first in a suite of conversations. So I know you're going to put the evaluative questions. The last one is if you want to be in touch on this. I'd like you to answer all the questions if you can. There's not very many, but the last one is just so that we have a little bit of a group of people who want to be in touch on this topic as we try to figure out what to do next.
Exactly. So just before we do that, because we will all go off camera as soon as we move to the evaluation. So just to let people know, there are, I think, 4 questions, as Claire said. It won't take very long to answer them, but those questions will really be helpful for us as we move along in this process. So we invite you all to stay and answer those questions, and I'll leave the screen up for a period of time afterwards, just so that you're not feeling rushed. But before doing this, so I think we have 3 minutes. So I want to give everybody, all of our speakers, sort of one last opportunity to share some final thoughts and comments before we head out this afternoon.
I can start by I could reiterate how thrilled I am that we've had this session, and the willingness of all of you to join us, both as attendants and as presenters. And Monique, thank you so much for all your help organizing everything. And pass it on to Josh.
Yeah, this was just a pleasure to be a part of, and I'm so encouraged by how many people attended, and reviewing the chat. It just shows how many people care about this topic and about helping others. So it really warms my heart. So thank you.
Kim?
Thank you so much. This was such a pleasure to be part of, and I think also it's just, this is something that I think really tugs at our heartstrings, and, has been going on for, a long time. And I think it's really great that we're talking about it in such an open and constructive way. And I think, you're right, Claire, it's the start of many conversations to shed a light on this and what we can do to help people.
I hope so. Rob?
Yeah, and I'd just like to say thank you for inviting me and allowing me to participate. This fraud issue that we're all facing, this is a global issue. It's going to take participation from individuals around the world to be able to put a dent in the fraud that is out there and in the recovery emotionally for individuals that are victimized. And I applaud you all for taking that kind of first step of, one, coming up with the idea to hold this webinar, but also for all of you for attending, because the first step is to talk about it, right? The more we start talking about it, the more action we'll be able to move forward with. So I applaud you all for taking that first step, and looking forward to continuing the conversation and the fight as we try to upset this global fraud issue.
Thanks so much, Rob. Monique?
I've just been the silent partner here. No, it's great to see that this came together, that we found, I think, the right speakers to really help us start this conversation, and very thought-provoking. But also what I saw in the comments too is a lot of people saying there was some really valuable practical information. So thanks very much for keeping it really real, and not staying too into the theoretical piece. But I'm interested and excited to see where we might go next with this.
And Jillian, back to you.
All right. Well, thanks, everyone. I'll close out the session, so to speak, and just echo everyone else's comments on thanks for the great participation. It's always lovely to have this level of engagement and interest. And as noted, I'll be moving the screen over to the evaluation questions. So just take a few moments of your time, if you would, just to participate in those. That'll be really helpful. And I'll keep the screen up to like 1:40 so no one feels too rushed. But thank you, everyone. And of course, Claire, thank you for spearheading this process and getting us all on board and collaborating together as partners as we do. I'm really, really appreciative of that, and so happy that we could be part of that. So thanks, everyone. Have a great rest of your afternoon. And until next time, take care. Bye-bye.